Well, I think the president and our governor have done a great job in trying to help people. I've been spending most of my time trying to help people with unemployment, with housing, their mortgages, the small business loans, all those things that have to be done to try to keep things going during this pandemic. So, I fully support what the president's done from the national perspective. Thank goodness he put that level 4 travel ban in place early when he did, so that the China travel stopped. And then our governor obviously put the emergency declaration in place very early as well. And so I think between the state and between the nation, people are being taken care of well. I'm not sure, if we need another stimulus or not. I think we just need to try to get people back to work and do it safely. If you follow the CDC rules and the OSHA rules, business can continue, and it can continue safely if we just all follow the rules.
So how do you feel about these mask mandates that cities are implementing? Do you think that should be done at a national level, or?
No, that should be done on a local level. I think local control is very important in our country. I think our state and our federal government can make recommendations relative to these kinds of things, and then at the local level they can be, implemented if needed, because not every area is really seeing infection rates. Some are not, some are. So I think it has to be done at a local level on a case-by-case basis.
And then, if you are in favor of replacing Obamacare, do you have any healthcare plans that you'd like to implement? Or
Yeah, sure. When we had control of Congress years ago, we didn't do what we should have done. We didn't. The Republicans in Congress didn't keep their promise. That's why you see America versus socialism now. That's what's happened. Obamacare was one of the things we should have taken care of, and we didn't. If we repeal Obamacare, then what needs to happen is you have to have in place those personal, portable policies, healthcare policies, such that you can take from one employer, say in Tennessee, to an employer in Virginia. And you have to have health savings accounts and good telemedicine, which has to have federal legislation to make that work as well. And concierge medicine is great, so that you could, have a physician and pay that physician a retainer to be your physician. All those things have to have federal laws to pass to make them work. And so I think we do need to repeal Obamacare and get back to good patient-centered, physician-centered health care.
Yeah. And any specific plan or policy you'd like to see implemented to kind of help replace it?
Yeah. You got to have those personal, portable policies. You got to have health savings accounts. You got to have good telemedicine, good concierge medicine. All those things together from a good patient-centered, physician-centered approach, market-based approach. That's what you got to have for good health care.
Performed pretty well in the poll we did.
Anything
else about the campaign?
I was really proud to see that I was in that top level of polling that the WJHL did, because what I've been doing with my time at this point has been, as we said before, helping people with unemployment, their housing, small business loans, all those things that need to be taken care of to help the people I serve in the Senate district during this pandemic. So now that I'm kicking in my congressional campaign, I think you'll see hopefully the poll numbers go up, and I'll be starting my television and my direct mail and all those things now that have to be done, from a campaign perspective. So I think I'm in great shape. I'm really excited and really pleased with what I'm seeing so far.